Welcome to What She Does, the podcast that takes you inside the working lives of everyday women shaping the world around us. I'm Liane Starr.
And I'm Annie Sinzinger. And each week, we sit down with someone who shows us not just what she does, but how and why she does it. Plus, find out if you fit the same mold to grab the same type of gig. Let's discover
What She Does, starting now.
Most people hear pharmacist and picture the counter at the drugstore. Today's guest is anything but that. She's a hospital-based clinical pharmacist who spends her days doing the math that keeps the sickest kids in the ICU safe. Because when you're treating a toddler, you can't just eyeball the dose. She's also a mom who says the job has changed the way she parents. This is the story of the drug expert nobody sees, standing right at the bedside.
Our guest today is Kitty Sum, who is a pediatric pharmacist. So, hello, Kitty.
Hi, how are you?
I have many questions.
Okay, I'm ready for you.
how does one become a pediatric pharmacist? And it's very specific, like pharmacists. I go to CVS, there's pharmacists there, but you are a pediatric pharmacist. So
Yes. I'm actually originally from Hong Kong. I came here for college and then pharmacy school. From early on, I know I want to be in some sort of profession in medicine. I was debating between being a physician versus something else when I was in college. But I realized that I really don't like needles or blood or procedures. And the schooling, it's very long, as you know. And therefore, I'm like, okay, well, I want to pick something kind of similar, but something that I won't have to touch a needle or blood or anything to that nature. Then pharmacy or the education in pharmacy kind of pop up for me as an option. And so that's how I decided to go into pharmacy because I want to know about medicine. I like the medication part of it. But yet I don't necessarily want to hands-on take care of a patient per se and to do procedures and things like that. And then the schooling is much shorter.
okay.
Yep, yep.
So I got pharmacist, but I didn't get pediatric.
Yes. So then so the pharmacy school is typically 3 to 4 years, with or without a bachelor degree. So pharmacy school is just a general. It's just like medical school. So everybody goes there for 3 to 4 years, and afterwards we have something called residency, just like physicians. So what it is it's just like a year of extra training. Um, and theoretically, I don't really need it to do that. During my residency, it was not very popular because it's something kind of new. But then I've decided to do that because I want to do something called clinical pharmacy. So my focus is going to be on medication, so medicine itself, the treatment. How I got into pediatrics is because when I did my residency, I got really fond of the specialty or pediatric rotation. Specifically, I'm really actually really like intensive care medicine. So I work more time in ICUs. And then at that time, my boss really needed somebody to help her out with the pediatric service. And therefore, I kind of did adult ICU and then she trained me a little bit in pediatrics. And therefore, after I was done with my residency, I stay on at that hospital and work in their pediatric service as well as their adult ICU service. But right now, I'm only doing pediatrics for the most part.
So it seems like you kind of fell into this. so so that is how you became a pediatric or pharmacist?
Well, the pharmacist part, yes. I think this is Yes, the profession of pharmacy is really for somebody who loves medicine, who likes to know more about medicine with the emphasis of the treatment. Well, say, for example, if you come in with a cough and a fever and things like that. So the physician's job is to put all the puzzles together and say, okay, well, you need an x ray. Okay, I'm going to listen to your lungs and things like that. And then the physician is the person who would say, okay, you have pneumonia. And then, okay, well, you need an antibiotic. So obviously, the physician knows what you should get as an antibiotic. But where I come into play is okay, well, you are this number of years old, you have this other medical condition, and this is your labs and things like that. And so, like, I'm part of the team to make sure that you get the best antibiotic for what you have right now. It's best for you in particular. And then, okay, well, if that's the case, what's the dose? Is it the right dose for you? Is it the right duration for you? And things like that. Oh, well, it might interact with one of the medication that you take. So my job is more like to make sure that the treatment part is the most optimal for you. And then I work with them side by side also to, if let's say, God forbid you're in a hospital, then when you're in a hospital, then I will just make sure that you're improving. And if it doesn't work well, or if there's any situation going on, the physician will be like, hey, Leanne is not really doing well and I'm not quite sure what's going on. Or, hey, I found this new piece of information from the blood work. What do you think about what we should do? Should we change the dosing? Should we change to another antibiotic? So that's where I come into play. And I also help the nurse. Say, for example, the nurse has issues with giving you the medicine or there's something wrong. So I'm the one who kind of nitty gritty of the medicine and say, hey, you should do this and that, or hey, you have to give this first and then wait for the other medicine and things like that.
So, do you have much interaction with kids?
So my job right now, I do see patients sometimes, as in I will talk to them about medication, especially if for more complex patients, that they're on tons of medication. So for example, we have pediatric patients who had transplants, so there will be a lot of medication. It's anti-rejection medication. So any chronic patient who comes in with a lot of medication, so I will see them when they are first admitted and just kind of go through all the medication that they're on at home. Whatever you have in the computer system may not be accurate. So I'm essentially the gatekeeper to make sure that the medication that the patient takes at home it's accurately documented. Because then that way, the physician, if they want to restart some of the medication, they have the most accurate list. So I do see them sometimes, and there are some medication that requires me to do more detailed education or by the time when they go home for me pediatric medication. So I do go in and just, talk to them about the medication. Do they know how to draw up our oral syringes? Because a lot of them are oral liquids for parents. So the education is mostly for parents. But yes, I do have some sort of interaction with them.
Kitty, I was going to ask you because you mentioned a couple things. One, that you like working in like ICU or
Hmm.
those situations.
Yes.
Um, why specifically pediatrics?
I think that I think it's because of my training and then the opportunity. I didn't necessarily want to go into pediatric that specific, or pediatric ICU to be very specific. But, once I get into the field, I realize, um, the field of pediatrics is it's quite different from adult in a sense that, um, you have parents involved. So a lot of the times, you kind of have parents that you have to consider. And also, they're I think people are more optimistic. Say, for example, if a patient in ICU, right? If a
Mhm.
patient, just think about it. If the acuity or the sickness is about the same, having a 90-year-old versus a 2-year-old, your mentality is very different, right? So,
Mhm.
like in a 90-year-old, you're kind of like, well, that patient's been through a lot. Just maybe calm down, not go crazy with the resuscitation part. But for a 2-year-old, even though if you're very sick, you will feel like, well, you want to do a little more, and they are very resilient, even though like their body size is much smaller than an adult size. For the medicine part, I really like it because I think I'm a pretty detail oriented person. And for pediatric medicine, it's very different from adult in the sense that we may deal with less disease state, we may deal with less medicine, unlike adults, but then we don't dose them just one dose. Typically, everything is based on body weight. So you
Mm.
can give an extra strength Tylenol to a 1-year old patient, right? We take an extra strength Tylenol for our headache, but we can't give the same amount because everything is on body size. So there are more consideration when it comes to dosing and monitoring and how the medicine is given. Pediatric itself, it's a big specialty because you have babies, right? And you have infants, you have toddler, you have adolescent, then you have like almost adult, older kids. So
Mhm.
like the medicine and then I guess medication or pharmacological consideration in each population is very different. So that interests me because it's a little like it's different from how adult is. And then the disease state, it's more appealing to me also.
So, listening to you talk, I was like, "Oh, pediatric, that would be fun." No, it seems like you're dealing with people who have a serious illness, and, this seems am I wrong? It seems really depressing.
There are times, yes, absolutely. I mean, you've seen cases where a patient is coming in with trauma and that the trauma, it's not accidental. It can be caused by parents. You probably hear something called shaken baby
Mm.
syndrome, or,
Yeah,
so you do see something like that where, patients coming in with conditions that's really, say, requiring ICU admission. And next thing you know, you realize that because they can't talk, right? Like, say, think about a 1-year old or even a few months old, they can't talk. And little by little, then you realize that, well, most of the injuries or the issues have something to do with the parents. Or on the other hand, I will work in neonatal ICU, so baby ICU, where parents have been trying to have babies, and but one reason or the other, the baby was born very premature, and then there's complication one after the other after the baby was born, and then they have to let go.
oh god.
So there are a lot of sad um,
Yeah.
situation. I mean, sad outcomes, but at the same time, like I said, I think pediatric patients, whether it's baby or adolescents, they're a little more. They're very resilient. So you see somebody who's pretty sick, has tubes all over the place, like with tube from a heart, from from the lungs, and then all IVs, like several IVs all over the body. In 2 months, the 2-year-old is going home, walking on himself. Like things like that. It's not everything that it's all negative. There are a lot of positive side of it. Or, you have babies who's born less than a pound.
Wow.
Well, several years later, you see that kid grown into like 20, 30 pounds.
Okay.
Or, you've had, say, oncology patients. So we do have oncology patients. So like cancer patient, when they're first admitted, maybe they're just 2 years old. And then when they're done with the treatment and cancer free, you're looking at elementary school kid size. So you've seen the growth. And so that's also one part that makes my job more, I guess, satisfying is to actually see their growth versus, adult, whether you're 20 versus 30, it's not that big of a difference, right?
So, it seems like there's a lot. Some of it's good, some of it's not so good. So, what do you do to deal with stress?
Uh, the one thing about pharmacists, I have to say, is that most of my most of the position, I'm not saying all, a lot of positions are paid by hours. In other words, you say, for example, my shift is 10-hour shift. So I go in and I clock in, and 10 hours later I go home. And it's um it's a hospital, right? So there's going to be 24/7, there's going to be somebody who will take care of your patient even if I'm not around. So if it's any stress coming from work, I know that it's not gonna be like, okay, well, Kitty's gone, then no one takes care of it. Somebody's gonna take care of it, right? It's a dynamic 24/7 situation in hospital. So when I come home, I know that whatever that's going on, it's gonna be taken care of. So I feel like I can go back to being a mom or being a wife at home. During work, also, I can't say adult is not, but typically pediatric medicine or the environment, people are I've worked in adult and pediatrics, but I would say in general, pediatrics, the environment is more friendly. So like,
Mm,
the physicians, the nurse, anybody around, they're just nicer because maybe they're
that's good.
close to kids. You can't be a me,
Mhm.
like, like you gotta have some sort of personality because you
Yeah.
do deal with a friendly personality because you deal with kids. So say for example, during work and I'm very stressed because, it's really busy or I have somebody who's really sick, I don't know what to do and things like that. I feel like I do have adequate support from my pharmacy department, and also from other people on the nursing unit in the team to, support me.
Do you get time off? Like, it's not 10-hour days every day, or is it do you get a day off and then a
So I am working part time. So typically in pharmacy world, again, I'm just doing one of the many specialty the pharmacists can do. There are people who work in industry, like they work for a drug company, and then obviously you know about the CVS, the outpatient pharmacists.
Mhm.
There are also pharmacists who see patients at clinic, like Kaiser has pharmacists run clinic for hypertension or hyperpressure or cholesterol problem and things like that. So depending on what position, typically there's an option to do part time, or to do number of shifts. So depending on where you are. So for me, our shift is 10 hours. So full time will be 4 shifts per week.
Oh, okay.
So like 40 hours per week, right?
Mhm.
So um my specific position, I don't have a set schedule and I do have to work weekends and I do have to work holidays because it's a hospital. But there are other hospital pharmacists has a set schedule and things like that. So, but for the most part, you work X number of hours. I would say a good half of the pharmacists do need to work weekends because, like pharmacy or, hospital, they don't, I mean, close on weekends, right? But for me, I only work 2 days a week. So the rest of the days I can do whatever I need to do as a mom and a wife and myself and myself and myself.
So I think that's important to denote that there are different types of roles within pharmacy, and you pointed out quite a few of them. I know that most people's idea of a pharmacist is, and I think Leanne even mentioned this earlier, was you go to CVS, you get your
Yes.
medication, and that's
Yeah.
it. But
Yeah.
you're a clinical
Yeah.
pharmacist in a hospital,
Yes.
um, and you said you have a 10-hour shift.
Mm.
What's the typical shift look like for you? Like when you go to
Uh,
work, what's your day look like?
So my day looks like this. So obviously I have lunch in between. I can take breaks and things like that. Depending on what shift I'm doing, I do have different shift, but a very typical day is, say for example, I'm covering pediatric ICU today. As you may kind of know, like morning is the action, right? So like the doctor will go what we
Mhm.
call rounding. So like the doctor, nurse, or whoever will go around each patient and to look at the patient, examine the patient. Some of the lower, like residents or interns, so they're still training doctors, will probably do more thorough examination and things like that before the team actually go around, which consists of attending, who's the trained physician. So they usually round in the morning. So like before that, I will just look at my patients. So right now, technology is great because everything is on computer. So say for example, you know, um, Mr. Smith, I mean not Mr. Smith, like let's say, Mary is admitted to a hospital, 2-year old. So everything that the doctor wrote about the patient from yesterday, any lab, any blood work, anything, it's on a computer system. And so I can sign in and look at, okay, what the patient received in the last 24 hours, anything happened. The nurse might write a notes and then what's the blood work and things like that. And then also um, I don't know how you see about orders. So I focus on medication orders, right? Because I'm a pharmacist. So the doctor can write a medication order and say, hey, Mary is sick. I need to write an antibiotic. So instead of calling me, they will put it in the computer system. So on my end, as long as I sign in that computer system, I can see, oh, okay, Dr. Smith put in this antibiotic for Mary, and so anytime, anywhere, as long as I have got computer access to that system, I will see, oh, okay. So in the morning while I'm looking at patients, they're not gonna stop their work, right? So I'll still look at all the medication orders, and then and once I'm done, then we have something called pharmacy technician. So they only need 2 year of training after high school, so they will be the need person who actually prepare the medication. So say for example, it's an IV medication. So that person will prepare that medication. So if I am around, then I will be the last person who check it is what it is. It's not expired. This is the right dose before it gets out to the patients. And typically the nurse will administer it. So these kind of things happens throughout the day. But going back to more my clinical job is then I will, once I'm done, say for example, they round at 9 o'clock, then I'll physically go to the pediatric ICU, the unit, and then I will just join them for their rounds. And then sometimes the physician will have questions and say, hey, I have this medication for blood pressure, but it's not really doing well. Hey, Kitty, what do you think? How much more can I increase? Are we at maximum dose and things like that? So stuff like that. So then, I'll be like their drug consultant right there and then too. And
Yeah.
then if I have any question, then I'll ask them and things like that.
You mentioned you're a mom, and with your training and now having gone through medical school and everything, does that color you know, how you are as a mom, knowing the things you know as a doctor?
Absolutely. I think first off is sometimes um I definitely have the knowledge base, right? So if let's say something happened with me, um, I mean with me from an adult standpoint, for my husband and for my kid, that I know I can be a little doctor before I even take them to a real physician to, and that at the same time I'm a little like, then I won't be freaking out for every single thing
Mm.
because I kind of know. But at the same time, I'm also a little more more cautious as a parent because I work in pediatric ICU. So I see things that you guys don't see. Say,
Mm,
for example, like, okay, well, I've had pets is, like animals is great, right? Animals around kids are fun, but I do see trauma coming from a pet, their own pet, causing really serious trauma to a small toddler.
mm,
You guys may not see it. So, like, for me, I'll be a little more cautious about things or, like, trauma like a dirt bike or anything. So, I
mm,
see the bad side of a lot of things. Obviously, like, I also see, okay, well, this patient only has a headache for a long time and unattended. It turned out that the patient has a tumor in the brain. Those are more extreme. So, like, there's good or bad of um, my profession in the way I parent. I feel like I'm more calm to try to sort things out, but at the same time, I can be a little more cautious about things because I do see the really severe bad side of it.
So you're telling me that you got an ATV and a pit bull for a kid, right?
Absolutely, yeah, yeah, you actually right on. So, like, if that will, yeah, that will be a not a thing for me. Not to say that other families not doing that. All I'm saying is the experience I've had and where I work, it will make me definitely more cautious. Everything it's a balance, right?
yeah.
I think I would be cautious about that too, but
Yeah.
yeah.
I
Yes.
think our last question that we ask everyone that comes on the show is, what would you tell your younger self?
Um, I think I picked the right profession to be honest with. I'm very happy with 20 years ago. I'm very happy that I actually picked this as a profession. And because the income is stable. Money is not everything for sure, but I think having a stable income, it's really important when I want to have a family and also to do things that I want after um outside work, right? Um and then I am very happy also that I picked this profession. It really just fits my personality, what I like to do. And it also as a profession that I think for a lot of women, it's a great pick because it allows me to be part-time. Because like I said earlier,
Mm,
a lot of the positions are by hours or at least something that I can, hey, I just want to work 2 days a week. I can work all 5 days. Most of the time, again, it depends on what specialty. I told you, like, if
mhm,
you're in a drugs company, you might have to travel a lot. You might have to bring work home. But for the most
mhm,
part, I feel like I don't have to bring work home and that I still have a life. The schooling is not that long um, as compared with like like being a physician.
mm,
And
How long
so
was it?
I say, huh?
How long was it?
So the pharmacy school, the program is typically between 3 to 4 years.
Okay.
Right. And then, like I said, right now, I would say because pharmacist or clinical pharmacist it's more prevalent in many hospitals or like clinic.
mhm,
Residency is definitely more prevalent also. I would say most of the pharmacy schools graduate, I would say right now more than 50% will do some sort of residency. So residency is like, you're training. So you are not a
mhm,
hundred, you have a license, but you're still in a training. Um, um, but it's typically only 1 year. Somebody will do two. But after that, you essentially you can get a six-digit pay in California, at least. I don't know about like you get a six-digit pay um, versus if it's a physician, the medical school is 4 years, and then just regular medicine doctor is 3 years. And then if you want to go into specialty, then you have to add more. So it's just everything together and obviously expensive. But yeah, I mean, to tell my 20, I'm like, "Ah, good job. I'm glad I wouldn't, from a professional standpoint, definitely. I think I picked the right one. And if I to do it all over again, I would still pick the same thing."
Well, that's great. Well, thank
So Leanne, we can just go back in time and choose pharmacy instead of what we chose, right?
I kinda want to, yeah.
Yeah, but I would say there is the only one big thing that I think a lot of people can get, like, a big hurdle before you can even um do pharmacy school. I think a lot of people kind of got stuck with organic chemistry.
Oh,
Mm.
yeah.
So organic chemistry, I think, is a big one in undergrad. So you do have to get through some of the classes um, before, I guess, the fun stuff about disease state and things like that. It's just, it is, but yeah, I mean, I'm very happy with my decision.
Great. Well, thank you so much for being on our show, Kitty, and
Yeah.
it's been great to talk to you.
Thank you, Kitty.
Yes, thank you for letting me on. And I hope people will have a different perspective um, and view about pharmacists, because we really, there are a lot of pharmacists who are out there that's not just behind the counter. Don't get me wrong, they're wonderful. I can't do their job. I'll be like, oh my God. Like, they're wonderful pharmacists. It's just very different than what I'm doing.
I don't know if I have it in me to be a pediatric pharmacist, but I like the half-time schedule a lot.
Well, I think as a mother and wife,
Yeah.
or just even a mother, having the flexibility of
Yeah.
part-time is really helpful, in terms of the family unit.
And she got through it in 3 to 4 years instead of, like, it just seems arduous to do the stuff for medicine, the residency, and the schooling. So that seemed a better way to go, honestly.
Well, she wanted to do something in medicine, but she didn't like blood and having to deal with procedures and needles and things like that.
Right.
So pharmacy certainly is a great option, and I wish I'd considered that when I was
Right.
back in school,
Oh my
because
god.
I actually like organic chemistry.
I'd do it.
I wish I could go back and do it. But I would say that, she also made it very clear on the schooling side, clearly you have to have a bachelor's degree,
Yeah,
possibly possible masters, or you can go to medical school, pharmacy school in this case. You do have 1 year of residency, and then if you do pediatrics in her case, you have to do another residency on top of that.
yeah,
So it is a shorter time frame than a physician,
yeah.
which is great. You also have to get a certification um, by the state because you're dispensing medicine. So and chemicals.
Yeah. Hopefully, your schooling has prepared you for the certificate, so that's kind of well, that's fine, but
And you get paid well.
you get paid really well, 6 figures.
I mean, for even if you're doing half time, that's still really good.
That's still good.
Yeah. So in that case, it's sort of like a win-win-win in a lot of different checks a lot of boxes.
Yeah,
There's definitely good job outlook for pharmacists in general. And while retail pharmacy is shrinking, so it's your CVS's and your Rite Aids and those kind of places,
yeah,
um, clinical is actually growing because more people are needed in hospitals. And so that's good. I would say the types of places, just for people's awareness, is children's hospitals, traditional hospitals, specialty outpatient clinics, and you can also go into academia and do research
yeah,
as a pharmacist too. So there's a lot of different opportunities to take your pharmacological knowledge and do that. By the way, that was really hard to say.
But yeah. Uh, so anyone who's listening, pharmacy.
Thanks for joining us today. That's what she does, and maybe what you could do too. If you like what you heard, make sure you follow What She Does wherever you get your podcasts.